Good evening, I'm Saul Sainz, and this is a special edition of ABC-7 Xtra. Tonight, we'll give you a rare and exclusive look inside Del Sol Medical Center, and we'll take you inside an emergency room and an intensive care unit where COVID-19 patients are being cared for.
Good afternoon.
Hi there.
How are you?
I'm doing great.
Good. Any cough?
No.
Or any shortness of breath?
No.
97.7. I'm going to spray your hands with some hand sanitizer.
The hospital has limited visitation. Staff checked my temperature, sanitized my hands, and had me remove my face mask, providing me with a sanitized hospital mask. If you have a fever, you're turned away and asked to see your doctor for a checkup. We were met by Chief Medical Officer Dr. Ogachika Alozi. Dr. Alozi is an infectious disease expert.
The important thing is that when you come into the hospital, what we're focused on initially is just how sick are you, right? As you can imagine, there's a lot of concern, there's a lot of fear and anxiety, but not everybody that appears at the emergency room necessarily needs to be admitted. And so once we've made that evaluation, if you're sick enough, you'll come to the ICU. If you're not that sick, we have other floors where people are, they'll get the care that they need.
Got it, okay.
So we've actually taken a subterranean passageway to get to our emergency room just for patient safety and patient privacy. We're going through our first floor, which has a host of things. Our labs down here, as you can see, some of our supplies, laundry.
If a person tests positive for COVID-19 and is very sick, do they go to the emergency room or immediately up to ICU?
They'll go to the emergency room. Anybody that comes into our hospital in the emergency room first. We have to ensure that they can breathe okay, they may or may not need oxygen. We may give them some medications or some fluids to stabilize them. And then we can then make a decision. Do you go to our medical surgical floor? Do you go to the ICU? Or maybe you go home.
And ventilators, that's obviously something that's talked about quite a bit, most especially with patients who have respiratory issues. Are there ventilators in the emergency or ICU?
Both. And so we're really comfortable about where we are with the ventilators. I think one of the things about ventilators specifically is that because of the power of our network, the Las Palmas del Sol network and HCA, we're very comfortable with the amount of ventilators that we have.
Tell me what we're looking at right here.
So these are respiratory precautions rooms. So what we've done is to keep people safe. We've closed off areas, and we put people that are at risk behind this. So there's air behind it, it turns it into negative pressure, it scrubs the air, and then they're able to stay there and be safe to everybody. So I'll say this. In March, if El Paso had had the same epidemic rate as New York, we might have had concerns, right? I believe that we've learned. We've been able to enhance our supply chain around PPE. We've been able to treat and manage this disease much better than they could in March and April, and our supply chain around ventilators is much better, right? So even though we have more patients and cases in the city, the key thing is that we've learned those lessons. The lessons and unfortunate deaths of New York didn't go to waste because we feel in a much better capacity right now than we would have if this had happened in April.
Every emergency bay is thoroughly sanitized. Now, staff here at Del Sol Medical Center have treated multiple COVID-19 patients. They've had 40 COVID-19 related deaths. While we were there, one emergency bay was being prepared for a patient. Every bay is sealed off, the air pressure is controlled, reducing contamination between bays.
There was a recent report that said if we as a community were to do universal masking, we could essentially reduce this to minimal proportions in 4 to 6 weeks.
Should that happen?
I think it should. Is 4 to 6 weeks too much to bear the cost of what's happening to our community? The people that are suffering because they don't have jobs, the people that are suffering because their businesses have shut down, the kids that are suffering at home. I think as a community, it's our responsibility to wear the masks. Let's reduce this to a point where my kids can go back to school. Your grandkids can go back to school.
That's my next question. Should we open up the schools, or are they doing it safely now? Dr. Carranza said you can't open the schools as in-person classrooms until after August 7th. Your opinion on that?
Again, there are going to be a lot of differing opinions. I think reasonable people can take different sides. What I do feel is that when we initially started talking about schools, we didn't have the spread we had today. It's a different type of spread, and it has to be a different approach. I think what the city's doing, the county, and the ISDs primarily, right, I think it's appropriate. I think they're taking a step back. seeing what happens, and making another decision based on that data. What would not be appropriate is if we stick to, well, we said this in April, and we're going to run that all the way to September. You know that's not how things happen. Plans change based on the data, and we have to focus, what does the data show us? When can our kids go back safely? When can we open up safely?
Okay. I don't see a lot of patience. I don't see a lot of mayhem, a lot of chaos. Why is it that we're not seeing all that?
So I think there's a host of reasons. One, an ER's chaos is something that's always driven by the TV. The ER is not supposed to be chaotic. Right? We have professionals here from the medical side, the nursing side. We assess patients, we get them into the right level of care, and then we take the best care of them. I think what's also important to understand, and this is where the community has to understand, people are afraid. And it's important for them to understand that we're still here. We haven't gone anywhere. We're still prepared to give the best care in the city. And we need them to come in. People that are having heart attacks staying at home 2 weeks. People that are having strokes coming in 2 weeks later. That's not good for them. We're prepared to give the right care, and I think that's what people have to understand. I truly believe that hospitals are still the safest place in the city.
Testing is chaotic right now. A lot of people waiting for long periods of time. Do we need to improve the way that we test and the way that we get results back?
We're very comfortable with our testing. Whether we're using rapid testing, whether we're partnering with the city, whether we're using commercial labs, anyone that walks into the hospital and is admitted has a test result within 24 hours. And we're deliberate around that, specifically when we're doing surgeries and we had rapid testing. I think that until we get to a point from a community that you can test when you want, you can get a result within 24 to 48 hours, we're going to have an issue. Because anecdotally, I know people that have been sick for 4 days, have gotten a test, and the test result comes back 6 to 7 days later.
Is that dangerous?
They're getting a test result after they're no longer infectious. Yeah. They've been infectious for 10 to 11 days, and then they're getting a test result. We need to work on ways to improve that. And to be fair, the city and county have done a great job of ramping up where we were in April and May to where we are today. They're creating partnerships. I'm really excited about the UTEP partnership, right? That UTEP partnership has the ability to double where we are right now, and I'm really excited about Dr. Kirk and what they're doing there.
Antibody testing, your thoughts on that? Do we need more of that?
Antibody testing really is a surveillance tool. If we need to know what percentage of our population has already had coronavirus, that's where the antibody testing come in. One of the things about antibody testing is it shows if you've been exposed, but it doesn't tell if you have active disease. So from a community standpoint, if we're trying to reduce the spread, we need PCR testing. I mean, that has to be the holy grail around testing. What's important about that, however, is that if we can get antibody testing surveillance good enough, we can really know how to plan. Have we only had 2% that have been infected, 5%, 10%? Each stage of testing or each stage of exposure is a very different planning for the city and the county.
You're watching ABC-7 Xtra. When we come back, Dr. Elozi takes us to the intensive care unit. We'll be back.
She said she wasn't hungry. She only wanted a bite. But this isn't just a patty melt. This is a Whataburger patty melt, the all-time favorite, with 2 all-beef patties, Monterey Jack, grilled onions, and creamy pepper sauce. So 1 bite became 2, and 2 became mine. Just a bite, huh? Good thing she's your other all-time favorite. Good thing there's the patty melt at Whataburger.
I'm Carla Griffin. During this period of uncertainty, many people in our community have reached out to Watson & Griffin for answers. We have made accommodations to start consultations over the phone. If you have any questions about your financial future, please call us. We're here to help.
Now that we are gradually returning to our activities, we must make sure that our children are strong and healthy. It is important that they are up to date on their vaccines and have great physical and emotional health. That's why at Salud Vida, we have multiple pediatric services available to you at our 4 locations. Because for you and for us, our kids are the most important people. From the heart, we say, you can count on me. Salud Vida, Dr. Rafael Armendariz Clinics.
Tired of being cooped up at home? Tired of that same old furniture? Not sleeping well? Let Dow's and Thomasville Home Furnishings help. We've been cooped up too, and our showroom and warehouse is bursting with new furniture and mattresses, all at 50% off. So if you broke the recliner, ruined the kitchen table, or just need a good night's sleep, don't worry about it. We've got you covered with 50% off everything and no interest for 3 full years. Dow's and Thomasville Home Furnishings. We're open and ready for you.
Are you ready to sink your teeth into a lemon pepper, sweet and spicy Korean cute-tastic, mango habanero
masterclass in all things wings?
Yes, I am.
Are you though?
Get Wingstop's new all-in bundle delivered for a limited time.
And so we're entering our ICU. This is where the sickest of the sick are really taken care of. You can see our teams. These are the teams and our nurses that are taking care of our patients. We have a 35-bed ICU. Again, not everybody in our ICU has coronavirus, but this is where we take care of the sickest of the sick.
Do you have a specific COVID-19 ICU unit?
No, we actually don't. So what we've done, specifically because we're very comfortable with the amount of PPE that we have, with the skill of our nurses, we put everybody here because that's where they need to be to get the best possible care. We're not trying to segregate them out. And as you can see, whether it's the PPE that's available, the shields that are available, we're just ensuring that people get the best care.
Right now, Del Sol is caring for around 240 patients. According to the hospital's chief operating officer, 60 of those patients are COVID-19 positive. We saw 2 COVID-19 patients on ventilators. Because of patient confidentiality laws, we cannot show you the patients. Any concerns because you have both everyone in ICU, COVID-19, as well as other people who are very sick? Any concern of contamination?
No, not necessarily. And again, one of the other things to think about is that as we've ramped this up, and as we've understood that the care in July is much different than it was in March, all the rooms have negative pressure. Right, so we've put state-of-the-art negative pressure, whether it's air movement, scrubbers, to ensure that that issue of cross-contamination doesn't exist.
What about staffing? When a staffing person is, are nurses dealing with only COVID-19 and don't go into other rooms, or do because of sterilization of the ICU units, you can have a nurse care for both?
Well, I'll say this, right? And again, I defer some of that to our chief nursing officer, but part of it is in the beginning, again, in March, April, it was very different. We had one person with coronavirus in the ICU. And so definitely the nurses were cross-managing, right? But now that there are a lot more, whether it's this hospital, other hospitals, much more patients with coronavirus exist, the reality is that the average nurse is taking care of, in the ICU, the coronavirus patient, right? They're not crossing across to take care of different types of patients.
That makes sense, yeah. We had 14 reported deaths on Thursday. Any concerns that this is going in the wrong direction? The numbers of people who tested positive, the number of hospitalizations, the number of ICUs. Are you concerned that this is going in the wrong direction?
I mean, I'm really sad of what's going on, right? Having 14 in one day, we've consistently had between 200 and 400 new cases every day. We're not going in the right direction.
Did El Paso and Texas, did we open up too soon before we really had a handle on things?
If I think back on a conversation that I think you and I had either middle or end of April, we said we're going to need to watch this specifically. If we let this get out of hand, if we engage in the social movement, because everybody was really excited to get out there, we may have to shut down in June or July. I'm not sure if we're there, and that's a political conversation. I think my focus is always, can we take the best care of patients possible? We are concerned because the more patients we get, the more capacity in the hospital gets reduced, right? And so my vision, my conversation with the community is, we need to take our own responsibility for how do we slow this down.
I'm sure you don't want to touch upon the politicized aspect of whether or not to reopen, but as a physician, as a medical expert, that I know you are because I've interviewed you many, many times, your thoughts on whether or not we should maybe roll it back a bit.
I think where we are right now, it's really important for people to understand what are those places that people are getting sick. Is it bars? Is it closed-door dining? Is it potentially gyms? And I know some people will say, well, you don't like gyms, bars, and indoor dining. That has nothing to do with it.
It's a spread.
What's really important is that we have to compare indoor versus outdoor, lots of people versus few people. The more you can reduce your risk, and the TMA's done a great job of creating a checklist for that, the more you can reduce your risk, the more you reduce spread.
You really didn't answer the question.
I know. Okay.
When we come back, Dr. Elosi shares with us the fatigue that some of the professionals here are going through in the middle of a pandemic.
America, we want to help get you back to it. And here's how, with the Ford Promise. Visit your Ford dealer. Finance a new, certified pre-owned or used vehicle through Ford Credit, and if you lose your job, you can return it for up to 1 year from the day you bought it. You can also get 0% APR financing for 72 months across the Ford lineup. Let us help get you back to it. Get 0% APR for 72 months on our full lineup of Ford SUVs at your Texas Ford dealer. Ford, built for Texas, built for you.
Great American Steakburger is El Paso's original steakburger restaurant, providing outstanding food and service based on the tradition of our founders since 1985. Our 2 locations on the east side at Yarborough and Montwood and on the west side at Mesa Hills near Sunland Park Mall have on-site, hand-cut, aged choice steaks, as well as an amazing selection of delicious seafood and, of course, our signature steakburgers. Dine in our family-friendly atmosphere or order to go and enjoy your favorite meal at home. Enjoy your next meal out with the Great American Steakburger family, El Paso owned and operated for over 35 years.
There's only one word to describe the savings at Oscar Leaser's Hyundai of El Paso. Epic! During Hyundai's Epic Summer Sales Event, you'll save thousands in interest with 0% APR for 72 months on new Tucsons and Santa Fe's. With no payments for 90 days and 3 years included maintenance. Plus new Tucsons only $229 per month. New Sonatas now $199 a month. And new Elantras now $189 per month. Get epic savings now at Oscar Leaser's Hyundai of El Paso.
My Oscar is such a big boy.
Scams are an everyday threat and are becoming increasingly harder to spot. At El Paso Electric, we want to protect our customers from becoming a victim. If you're suspicious of a person claiming to work for or with El Paso Electric, either on the phone or at your door, stop. Call us using the number from your electric bill and verify the information you've been given before you pay or sign anything. Know that El Paso Electric will never ask you to make a payment over the phone or in person. If you're suspicious of a scam, remember to stop, call, and verify.
Welcome back to ABC-7 Extra. Before medical staff enter any space where COVID-19 patients are being cared for, they must first wear extra personal protection equipment, or PPEs. Since the pandemic, staff has been working longer hours with little rest. In terms of medical treatment, what's your biggest concern right now?
The biggest concern is fatigue. Right? I think one of the things that we suffered from as a community was that we weren't New York, and yet we shut down. And so we had the fatigue to the community of not being able to go out, not being able to engage. The next level of that fatigue is the people that work here, the physicians, the nurses, the techs, our EVS, right? If they get tired, there's no cavalry coming in. Right? And so we need the community to understand anything they can do to reduce the spread, to slow down the amount of patients that come to the hospital, affects everybody. Right? Everybody has a chance to take that breath, catch their air, and wait for that next patient to come in.
How do you deal with that fatigue within this hospital? I mean, obviously, I can't ask you about the other hospitals, but with the fatigue within this hospital, do you have different shifts, roving shifts? What do you do?
Definitely. So I think from a shift standpoint, people take various shifts. I think we've tried as much as possible to over-communicate, right? So tell our staff, hey, here's what's happening. Here's what's not happening. Here's what we don't know. I often tell people it's really important not to over-assure people, right? Don't pretend that everything's all right when it's not. And so we've been really clear about our PPE, about the medications. We have weekly or every other weekly surge calls, right, between our docs and our nurses and our throughput directors. So everybody's on the same page. And I think for me, that camaraderie and that feeling that we're all in this together, I think that's been immense.
Does it surprise you that some nurses have been protesting and saying, look, you know, we need help here, we're tired, we're going through too much, and we're not being cared for? Yeah, does that surprise you that you've seen those protests?
It doesn't surprise me. It doesn't surprise me for a host of reasons. I think for somebody that has been in the HIV space for a very long time, I understand fear, I understand bias, and I understand concern. Anything that's new, people will always be afraid of, right? Coronavirus is new. The fact that we have to wear masks and shields and bonnets and types of masks that we're not used to wearing, it scares people.
There's been patients that we've seen, especially during the stay-at-home order, that were delaying their own personal care. And we saw significant declines in emergency department visits, but not just in ED visits, but we saw across El Paso, and not just within Del Sol, but across all the health systems. We saw a decline in the number of heart attacks that were coming in, decline in the number of strokes that were coming in. And what that's telling us is that people were delaying care because of the fear associated associated with COVID. And so the opportunity for people to continue to seek the vital emergent care that they need is something that we need to make sure doesn't become an even greater public health risk than what COVID actually ends up being. So we have a census right now of about 240 patients here at Del Sol. Only about 60 of those actually end up being COVID positive. Continuing to birth babies, continuing to have premature babies that are in our neonatal intensive care unit. We continue to have other emergencies that come in, vital surgeries that are being performed and otherwise. Certainly the changes associated with this have been difficult, but really the guiding principle that we've led by is what do we need to do to keep our caregivers safe? Because we can have as much brick and mortar, as many beds as what we could have, but if we don't have the staff to be able to take care of them, then what good is that going to be? And so a guiding principle that we've had here at Del Sol is how do we make sure that our staff are safe? We have seen, kind of with the shutdown and then subsequent resurgence, we have seen more and more staff getting sick through community spread. As we've traced the staff that we've had get sick here, it hasn't been from staff members who are taking care of COVID-positive patients. The PPE is working. The universal masking is working. It's from being out in the community and catching it from the various hotspots that end up existing in the community.
So have you had a reduction in staff by virtue of COVID-19?
We have had some staff who have ended up getting sick.
Talk to me about the psychological aspect. How does that affect a nurse?
It takes a toll on nurses, on healthcare providers, but it's important to have a support system, a team around to be able to give that support to them. So absolutely know that it does take a toll.
And I think it's also important for us to understand that we're not always going to have all the answers. We're building this ship as we fly it, right? And so sometimes people don't like that. Now, I'm not saying one way or the other that we do the perfect thing every single day. I think it's important to understand that we make mistakes as human beings, but the key is that we're trying our best to provide the best health care for the community.
At any point in time, we've heard about those horror stories in other cities where some doctors have to make difficult decisions and basically take people off or choose who goes on a ventilator and who doesn't. Have you ever had to have them made that decision?
I've had to make that decision in my career. Have we had to make that decision during coronavirus? No. We've been blessed, call it lucky. Sometimes it's better to be lucky than good, but we haven't had to make those decisions yet. And I hope that we'll never have to make those decisions.
Why is it that you haven't had to? Because you don't have the sheer numbers?
I think the key is that we're not Dallas. We're not Houston. We're not Austin. And even though we have less beds, less physicians, and less people from a population standpoint, our spread has also been less, right? So we're not going up at the same rate. You look at Houston just 2 weeks ago, they had a 25% positivity rate. We're still in the 11 to 13%, right?
Which is still bad because we didn't want to go over to 9%.
Well, I remember when we talked in April, we were around 5 or 6, right? And we were excited that we're at 5 or 6, right? Because I always tell people, 10% is foundational. What you really want to get to is 5%. That's aspirational. And so, yes, is it getting worse? Absolutely, but we're not Houston yet. And so we haven't had to have some of those horror stories, some of those tough decisions. I hope we never get there.
The medical community told us, and this I remember vividly because it wasn't just you, it was also Dr. Carranza and some other physicians who were telling us that the summer months would actually be beneficial because it would do away or at least reduce the number of cases. That hasn't happened. Why is that?
Yeah, I think it's unfortunate that that narrative caught hold. The conversation that people had around the summer and the heat making the coronavirus go away, it was never based on science, and unfortunately, it got induced into the system and people latched onto it. Remember, Sal, whenever people are afraid, they latch onto hope, right? Whether that hope is rational or not. And so we're suffering from that in a sense. And then we opened up, right? We opened up, people had fatigue of staying at home, and we're seeing just the opposite happen, and that's unfortunate.
What is it that you think we should roll back on with no bars? That happened already. Gyms. Your opinion?
Yeah, I think that it all depends on the gym you're going to. So I don't personally go to the gym, as you can tell. But I think what's important is that if people are making the decision to go to a gym, then it has to be with masks. It has to be enhanced.
Constantly or only when working
Well,
out?
I mean, I think the reality is this. More than enough gyms and studies have shown that you can exercise with a mask on. Right? If I were to put a pulse ox on you right now and you wore this mask, walk back and forth, or any other type of mask we have, your oxygen would be great. Right? So I know people say it's uncomfortable, and I understand that. But it's also uncomfortable to have the amount of patients that we have coming through our ERs and other ERs. And so if I have to make a decision between can you go to the gym every day versus can 100 patients be tested positive in our city, I'm going with our patients in our community 100 times out of 100.
Open dining restaurant.
Again, where I look at and where the TMA has been really clear, and I'm part of the TMA COVID-19 task force, is if you're making a decision between indoor dining and outdoor dining, it should be outdoor dining. If you're making a decision between closed air with air conditioning and outdoors, outdoors is always going to win. And so I think that's really what people have to focus on.
In-store shopping.
You can't avoid it, right? Unless not everybody can do delivery. Right, so we're going to have to understand that you're going to have to go out sometimes. We can't lock down our community forever. And I think it's also important, therefore, that we do the 3 W's, that you wear the mask when you go out, that you wash your hands. And I tell people, you don't necessarily have to wash everything down, but if your hands are washed, you're wearing a mask, you sanitize, you come in, and the stores are doing a great job right now. I've heard about a lot of stores mandating masking, reducing the amount of people that can come into it. That's really what we need to reduce the spread.
This has been an exclusive and eye-opening look from the front lines in the battle against COVID-19. For ABC-7 Extra, from inside Del Sol Medical Center, I'm Saul Sainz. Good night and buenas noches.